Axillary dissection is lymph nodes are removed and examined under the microscope. Not done as often anymore. More of the axillary nodes are removed only if the sentinel or the first node is positive for cancer. Then they will go and remove more. And part of the reason why is possible side effect of lymphedema. And lymphedema is where when you remove those nodes, it will cause lymph fluid to build up in the arm and hand. So this is a diagram straight out of your book in chapter 73. So surgical management of breast cancer, up in the upper left it shows the normal anatomy, and then upper right is a modified radical mastectomy where the breast tissue, nipple, and lymph nodes are removed, but muscles are left intact. You can see that they've got the two drains there. It's actually hooked to just one tube then coming out. That's just one type. We use JP or Jackson Pratt drains here, and so a lot of times it's two different tubes coming out and with two bulbs. The one in the lower left is a simple mastectomy where the breast tissue and usually the nipple are removed, but the lymph nodes are left intact. And the lower right is going to be the lumpectomy with the lymph node dissection, where only the tumor and lymph nodes are removed and other tissue is left intact. Client education regarding lymphedema. You want to teach them that to avoid tight-fitting clothing or jewelry on that affected arm. Carry anything like purse or luggage with that other arm. Use an electric razor for the armpit area, and then any shots, blood draws, IVs, or blood pressures should be measured on the opposite arm. Wear gloves when gardening or using strong cleaners, and then avoid burns or sunburns of that affected arm and hand. May need to be treated with compression bandages. A lot of times it's a physical therapist with extra training that can do these lymphedema treatments. And we use similar to a TED hose on the leg. You can put those on the arm, and they are very hard to get on. I had a friend of our family that had lymphedema in both arms, and she would wear a real tight brown TED hose looking thing on her arm. And so imagine too how hot that can be in the summer. So just teaching clients to be aware of the lymphedema is important. And then also the statistics show that 3 out of 10 women with the axillary dissection will get lymphedema. So with sentinel lymph node biopsy, we touched on this a couple slides ago, but it is a radioactive substance and dye where it's injected near the tumor, and the lymph system then, this is usually during surgery, carries that dye to the first or sentinel node to receive lymph from the tumor. And if the cancer has spread to that node, that is the one most likely to contain cancer. So that node is removed and examined. If it's cancer positive, more nodes may be removed. If it is free of cancer, then we have just saved that person from taking all those lymph nodes or several more out. So it is kind of the more standard of practice now. Adjuvant therapy. This is the decision to follow surgical procedure with radiation, chemo, or hormone therapy. So that's what that is adjuvant is just the additional therapy besides surgery. Okay, and how they decide on it is the stage of the disease, client's age and menopausal status, client preference, and pathologic examination, so when the pathologist reviews the tumor, and then hormone receptor status. So there's a lot of things that come into play as far as deciding, because then that will guide their treatment as far as which drugs and things to use. So the staging of breast cancer, there's different, from 0 all the way up to 4, and the TNM system is the system that they use. And what that is tumor size and spread is the T, N is for nodes, and M is metastasis. Stage 0 is the carcinoma in situ, or where it's just in the ducts, it's not spread. And then stage 1 is less than 2 centimeters, no lymph node involvement. And then you can see on this slide it talks about the stage 2 through 4. So 4 is the worst, where the cancer has spread. So it really doesn't matter of the size. It is stage 4 if it has spread to other parts of the body. Okay? And then A, B, and C, you will see those added to the stages 2 through 4. You do not need to be aware of those, but you should be aware that stage 4, it is any kind of cancer that has spread. Okay?